Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit npteff.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today will be part 2 of our ABG mini series. Now, before we dive into today's topic, let's first review a practice question. Over to you, David.
All right, let's do this. In an acute care setting, a PT is reading lab values for a patient and determines that the patient has uncompensated respiratory acidosis. Which of the following symptoms are most likely? Is it option A, hypoventilation, drowsiness, and blurry vision? Option B, diarrhea, muscle twitching, vomiting, confusion? Option C, hyperventilation, confusion, seizures? Or is it option D, nausea, vomiting, tingling in all extremities, and tachycardia? The correct answer is going to be option A, hypoventilation, drowsiness, and blurry vision. All of these findings are most consistent with respiratory acidosis. Great job.
So now that we have reviewed a practice question, let's take a further look at the symptoms, causes, and treatments for both respiratory acidosis and respiratory alkalosis. So first, let's review respiratory acidosis. Respiratory acidosis occurs when there is a pH of less than 7.35 and a PaCO2 of greater than 45. Now, what are the symptoms? I like to use the mnemonic CARBS, C-A-R-B-S. Now, I don't know about you, David. I love some carbs, but I do not want these types of carbs. Keep me away from respiratory acidosis carbs.
No, thank you.
So the symptoms, or our mnemonic CARBS, is as follows. C, confusion. A, agitation. R, restlessness. B, blurred vision. And S, seizures. So we can use that mnemonic of CARBS to help us remember some of those main symptoms that do occur. Now, additional clinical manifestations do include disorientation, sleepiness, visual disturbances, headaches, flushing, dyspnea, cyanosis, decreased deep tendon reflexes, hyperkalemia, and palpitations. Now, that is a lot of clinical manifestations that can occur. So we have found it most helpful to really prioritize that mnemonic of CARBS when remembering those primary symptoms that do occur with respiratory acidosis. Now, what are the causes? Decreased respiratory function, so hypoventilation, can lead to hypercapnia. That is the main cause. So things such as COPD, acute respiratory failure, even left-sided heart failure, because remember, that will present with more pulmonary symptoms, and drugs such as sedatives, narcotics, or anesthetics, because that can suppress our respiratory center, and even some central nervous system lesions or sepsis and burns. Really, again, anything that can decrease our respiratory function to lead to hypercapnia. Now, how do we treat this? We will be providing sodium bicarbonate, correcting the electrolyte imbalances, and supporting their ventilation to help try to increase their respiratory function to decrease that hypercapnia.
All very important to know, and I know that that's a lot of information. So what we are about to do is give you more information, of course, because that's what we always do. So now I am going to review with you respiratory alkalosis. Respiratory alkalosis has the symptoms or clinical manifestations including, but not limited to, tachypnea, Say that 10 times fast. Say that even 10 times fast. Woo. Hypocapnia, dizziness, difficulty concentrating, numbness and tingling, blurred vision, diaphoresis, dry mouth, muscle cramps, carpal pedal spasms, muscle twitching and weakness, hyperreflexia, arrhythmias, hypokalemia, and hypocalcemia. Now it is time to, let's condense it a little bit. How about another mnemonic? Here is a mnemonic that is no cards. So we had one with carbs before. This one for respiratory alkalosis is going to be no cards, as if you're going to play with a deck of cards. CARDS. So let's start with the no. N is going to be numbness. The O is orthostatic hypotension. The C, now we're going into the cards. C is confusion. A is anxiety. R is rapid breathing or hyperventilation. D is dizziness. And the S is going to be seizures. So once again, that mnemonic is no cards.
Now, David, I have a question for you. Actually, I have a joke. It's about cards. I thought I would swing it in here right now. All right. So why can't you have cards in the jungle? So why are there no cards in the jungle?
Oh, I don't know. I haven't spoken to Tarzan lately. What's the answer?
Because there's too many cheetahs.
Ha! I approve of that joke. We are not editing that out. That stays in here. That's great. That's a good one.
All right, back to the topic.
Back to the topic. So, ABG levels would be the pH is greater than 7.45, and the PaCO2 is going to be less than 35. So, that is going to be greater than 7.45 for the pH, and for the PaCO2, less than 35. Let's go into some causes. The causes of respiratory alkalosis would be from hypocapnia, like the night before the NPTE examination, which I don't know about you, Emily, but you know, you start to.
Oh, yes.
Yeah. So as you see, what are we doing right now? We're getting anxiety. We're hyperventilating. And you may recognize this hyperventilation, which is an increased exertion of carbon dioxide by the lungs. Conditions you may see in this include, but are not limited to, hypoxemia, pulmonary embolus, high altitude, impaired lung expansion, pulmonary fibrosis, ascites, scoliosis, pregnancy, CHF, stimulation of respiratory center, anxiety, hyperventilation, encephalitis or meningitis, hepatic failure, salicylates, aspirin overdose, theophylline, CNS trauma, CNS tumor, excessive exercise, extreme stress, severe pain, and mechanical overventilation.
Ooh, that was a mouthful.
Ooh, all right. We're not done yet. Let's get on to the treatment. So the treatment for respiratory alkalosis would include increasing carbon dioxide retention, also known as a rebreather mask, or treating the underlying cause of that hyperventilation, such as stress management techniques, which I don't know about any of these listeners over here, but stress management techniques sounds incredible and beneficial for anybody out there. What do you think, Emily?
I think that sounds pretty good. David, do you think Final Frontier does anything to help with that?
Ooh. I do believe that on the course page, there's actually an exam anxiety and stress management module for anybody that is enrolled that they can go through and just on their own and reduce their stress in doing so.
Sounds pretty good to me.
Sign me up. Now that you heard Arterial Blood Gas Series Part 2, here is a quote from Kurt Cobain. If opportunity doesn't knock, build a door. That's right. Don't just kick down a door, but build a door. You know where you want to be headed. And if somebody doesn't recognize it, then it's time that you build a door and you walk your way through that door that you built. So keep on going after your dreams. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Until next time, have a great day and a powerful tomorrow. Thank you once again.